Hello everyone, hope all's well. So, after brushing up the basics of what is diabetes in my first video, we now will go on to what are the symptoms diabetes presents with. The most common symptoms when I would suggest one should get tested is number one, increased urination. And this, when you notice, most importantly, you find the person telling you, I am off late getting up more for urinating at night. Previously, I never used to get up, madam. Now I get up every night. And it's not once, it's more than 2 or 3 times. And the quantity of urine is also quite good, you know. So, when if you have this complaint of increased urination off late, more so at night, I think you should get tested. The next most important is, along with increased urination, there comes this increased thirst. So the patient would say, off late, I drink a lot of water. I feel thirsty all the time. I'm drinking a lot of juices. I'm drinking more of tender coconut water. Get tested. The other important thing is there is increased hunger also associated with these. What happens, the patient will come and tell you, I'm feeling very hungry also of late, madam. My appetite is pretty good. I eat a lot. But at the same time, I'm not putting on weight. I'm losing weight. What happens? Whatever you eat, when the sugars are high, goes out in the urine as calories. So, with the calorie loss, the patient continues to lose weight as well. If you have any of these major symptoms, then yes, you should get yourself tested for high blood sugars, that is diabetes. The other very important symptom is frequent urine infections, or rather, even frequent genital infections, more often fungal infections. And this is a symptom which many find embarrassing to come out with or to tell the care provider. So, if you have any symptom of genital infection like an itching or any abnormal foul smelling discharge, please get yourself tested for diabetes. The other important symptom is, I would call the crying of the nerves. The nerves of your feet start telling you that the sugars are going up. So there are many who come to you with, off late I feel severe burning sensation under my feet and I feel it more at night. And there could be a pricking sensation also. There could be a pulling sensation also. So this is also an indication to get yourself tested. Associated with this, there could be also generalized weakness, fatigue in these individuals. And when the sugars are pretty high, patients do complain of some amount of blurring of vision as well. Yes, there are these symptoms, but something most important, please remember, diabetes is a silent killer. So, most of us are asymptomatic. We don't develop any symptoms. In that case, when do I get myself tested? Please go and get yourself a routine check for diabetes done if you are 35 and above, or if you're overweight or obese. Please do it irrespective of your age. I would suggest don't wait to turn 35, don't wait for your 35th birthday. Get yourself tested if you're overweight or obese right away. Or you have a strong family history of diabetes where your mother, father, grandparents, paternal aunt, maternal uncle, anybody diabetic, please get yourself tested. Or if you had, women especially, if you had a history of gestational diabetes, that is, if you had abnormal blood sugar levels during your pregnancy, or those individuals whose mother had gestational diabetes when they were in her womb. Okay, agreed. You go for the test. What will you get tested? Yes, the basic tests I would want a person with these symptoms to do and show their physician is a fasting blood sugar, which should be at least an 8-hour overnight fast, 2 hours postprandial blood sugar, that is 2 hours post breakfast blood sugar, the 3 months average blood sugar percentage, what we call as HbA1c, glycosylated hemoglobin level. If not, if you can also try an OGTT, that is this oral glucose tolerance test. All these tests are done in all standard laboratories, hospitals, And if you feel you have any of these symptoms, please get these tests done and rule out diabetes in you. What are the other tests that you can do? What are the other complications? That we will see in the coming videos. And now, what I have told you is only for type 2 diabetes. Type 1 is a different story all along, which I will cover later. Hope you had your share of knowledge today. Thank you.